Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Atopic dermatitis, we are looking at the eczema. Eczema, that is the UK refinement of the Hanifin and the Rajka diagnostic criteria. So, in order to qualify as a case of the atopic dermatitis, so to qualify for the atopic dermatitis, or it's known as the eczema. So, qualify for this with the UK diagnostic criteria along with the UK diagnostic criteria. So here the child must have an itchy skinny condition. So you have a itchy skin condition should be present. Next is or a parental report of scratching or rubbing in the child. So there should be a scratch episode present in the child. And there should be 3 or more of the following. So 3 or more of the following. So what are the following conditions? So the onset is below the age of 2 years. So onset is below. Onset will be below 2 years, will be less than equal to 2 years. And it is not used if child is under 4 years. And it is not used if the child is under 4 years. Next is the history of a skin crease. So there will be history of skin crease and skin crease involvement. And it is including the cheeks. It is including the cheeks. Including the cheeks in the children. So it includes the cheeks in the children under the 10 years. So the onset is below the age of 2 years. And the history of skin crease involvement. This includes the cheek in children under 10 years. Next is the history of the general dry skin. History of general dry skin. And there will be a personal history of atopic disease. So it will be a personal history. PH means personal. Personal history. And this is of the atopic disease. Okay. The personal history of the atopic disease. Next is the history of any atopic disease. Then a history of any atopic disease. Any atopic disease. And this is at a first degree relative in a children. This is the first degree. First degree relative. First degree relative in children under the 4 years. So in children under 4 years. Next will be the visible flexural dermatitis. So there will be visible flexural dermatitis. The visible flexural dermatitis or the dermatitis of the cheeks. So dermatitis, and this will be of the cheeks, or it will be of the forehead, or it will be of the outer limbs in children, or the outer limb in the children. And this is going to be under 4 years. Under 4 years. To learn and grow daily like this, please do subscribe.